the series about menopause, which we're doing under our Idea Exchange Forum of Maasika Mahotsav. Just to reiterate to everyone, what is Maasika Mahotsav? It's the country's first international menstruation festival, which we have been doing since 2017 with the only motto of normalizing conversations about periods. Our aim is that we make this festival one day a national festival so that it's celebrated across different parts of the country. And our partners are the ones who help us take this concept of period festival to different parts of the world. So, with that, for this year, we have a theme called Menopause. We take this opportunity to highlight this essential and significant aspect about periods, which generally do not is something that people do not talk about. And this five-part series about menopause talks comprehensively about every aspect of menopause. Today is our third part in the series where we address certain myths and bust them with facts. And there are various queries that we've crowdsourced as per the suggestion of our speaker today. And will be a question answer session where I will be posing the questions to our speaker. Now, not taking too much time, but I would like to introduce everyone to Dr. Meenakshi Bharath. She's a gynecologist with 35 years of experience and she specializes in fertility work. Her medical practice consists of making it easy for couples to undergo treatment to have children. Prevention is better than cure has always been her mantra, and her other passion stems from this mantra as she looks to prevent diseases created by improper management of garbage. From segregation to composting to using only reusable utensils and having a waste-free wedding for her children, she is extremely active in converting people to sustainable ways of living. Having retired from active medical practice in 2018, she brings her passion for gynecology and waste management together in the campaign Green the Red, advocating reusable menstrual products like cloth pads and menstrual cups. Her aim is to make all women enjoy their periods and not dread it and ensure that no trash comes out of it. Advocacy has led her to talking to the state government in Karnataka and spreading this concept of sustainable menstrual products usage among gynacs across India since Jan 2019. She has trained many Obgyn societies across India. She has been a prime mover in making Rotary change to distributing cloth pads and menstrual cup instead of disposable sanitary pads, and her knowledge in the field has eased the fears about using menstrual cup in over 1 lakh women and converted them to having a rash-free, trash-free, and cash-free periods. One of the objectives that completely aligns with Maasika Mahotsav, where we aim to promote sustainable menstruation. So that's in short about a lot that Dr. Meenakshi Bharath is known for. Thank you once again, Dr. Bharath, for joining us today for this session. And as per your suggestion, we've crowdsourced the questions. But before jumping onto the questions, if there's anything you want to add for today's session, you can go for it.
So let's start with, first of all, why is there so much silence about periods? It's because we don't talk about the benefits of the periods. We don't introduce our children, the girl child, to what is periods and when it is going to come. So around the age of 7, you need to start talking to the girls when their teeth fall off, the milk teeth and the permanent teeth start coming in. We need to talk to them about, the changes that will occur to the young child who will then become a lady in the space of the next 4 years. So nothing should come as a shock. So there is height gain, there is breast development, there is groin hair and underarm hair that is growing. And when all this is happening, then she is going to know that she is going to start her periods. So there is a process of development, and the development must be understood by the parents and the child, and including the father, and if there are brothers in the house, they need to know that what is happening to the girl child who is now becoming an adolescent is natural and nothing to be ashamed of. So if you look at this, This is the uterus model. The size of the uterus is the size of a fist. This is the ovary, which produces the egg every month. And the egg comes like this and settles here if there is going to be a pregnancy, if there's going to be no pregnancy, and most times there will be no pregnancy because we ovulate 400 times in our lifetime from age 8 or 10 to 50, 55. We ovulate, and when we ovulate and there is no pregnancy, then what will happen is that the lining of the uterus is shed and it comes down as a period. So we need to understand that. So like I said, we have 400 periods in our lifetime, and of that maybe 2 or 3, the likelihood of this generation having more than 2 or 3 children is not very brilliant. So therefore, we need to understand that. Now, we are talking of the other end. That was menarche that I was talking about, when a girl child starts her periods. And now we're going to be talking of the other end of the spectrum, which is menopause, when the girl child, when the lady who is 45, 50 will start the process of the period stopping. Now, the process of the period stopping, like I said, 400 periods, 400 eggs ovulated. And when the eggs get exhausted in the ovary, then that's when your periods become irregular and the periods are going to halt. So if the periods become irregular, most often post 40, you're unlikely to get pregnant. So pregnancy happens between, say, 18 and 40. After 40, the chances of getting pregnant are very minimal, and maybe, 1 in 20 or 1 in 40 people will get pregnant because the eggs are no more um, viable, and therefore they don't get pregnant. So once the uh, eggs are not being produced, then the periods become delayed. There is a gap. So 2 ways that the periods occur: either the periods become irregular, that means they don't happen every month, or they happen every month, but the amount of bleeding is reduced. So what is normal bleeding for a period is that you will change about 3 to 4 pads per day on the heavy day of your period. And in a whole period, the disposable pads that you're using, you will change about 10 to 12. So therefore, we know what is normal. But if you are going to be changing, say, 12, 4 to 6 pads a day, and the pads are all soaked, it means that you are bleeding extra. And what will happen when you bleed extra is that your hemoglobin will drop. And when your hemoglobin drops, then you become tired easily, you become exhausted. And so that is what happens if you're bleeding extra. So 2 ways that menopause occurs: one, your bleeding will become less, or your bleeding will become infrequent. Your periods will become infrequent. So those are the only 2 acceptable ways of menopause occurring. If you're bleeding extra, that means you're changing more than 3 to 4, 5 pads in a day, and the period is going on for maybe 8 or 10 days, which means that there is something in the uterus which is producing extra bleeding. You need to go to the doctor and check it out as to what is happening. So basically, all of us must start going to the gynecologist not only during our pregnancies, but post 40, at least once a year. And my request is that everybody goes to the gynecologist around the time of your birthday, so that you know that you are healthy, that you're not having a problem, and that you will not collapse one morning if you're bleeding heavily. So go to the gynecologist. The gynecologist is worth a visit. It's worth the money that you're going to pay her, because she's going to do an ultrasound to know that the uterus is fine. She's going to do a pap smear, and she's going to do a breast examination, so that the major problems that will occur for a woman post 40 will be looked at and caught either early, or you come back with a clean chit where the doctor says, "You're good, come back and see me after a year." So you can't get rid of the obstetrician and gynecologist just because you are past 40. So remember, go and have a checkup with your doctor without any worries. Get it done. It's worth the money that you pay her. One more sari in your cupboard makes no difference. Okay? Take the opportunity to consult your doctor. So that's how menopause occurs. And if the periods are excessive, please go and check it out. Don't let your hemoglobin drop. So that's an important part that you must check once a year. Do the blood tests. Don't only check the cholesterol. Don't only check the check the sugars and the HbA1c, but check the hemoglobin also. All right. Does So one question was, so what are the symptoms of menopause? The symptoms are really irregular periods. Now, if you have stopped your periods for more than 6 months, not got a period, yes, have a checkup and know that there is nothing wrong. But if you're bleeding excessively, checkup is all the more mandatory. All right. Symptoms are nothing, just irregular bleeding. Now, if irregular bleeding is happening post 6 months of stoppage of periods or post 1 year of stoppage of periods, don't say that this is part of menopause. Go and get yourself checked up and make sure that there is no cancer that is brewing in the cervix, no cancer that is going growing in the uterus. Very important to know that you are cancer free. So don't let it just go. So a checkup once a year post 40 is a scan, a blood test is all that is necessary. And it, like I said, it's worth the money. You'll be happy to know that there is nothing going wrong with your uterus. All right.
So I just would like to come in there, because you are speaking of cancer. There was this one question that we had from Snehal Chaudhary stating, can menopause process in itself cause cancer? That's something that a lot of people believe. So would like to seek your opinion on that.
No, no. The process of menopause, like I said, menopause is when the periods stop in the process. So it usually takes 3 to 4 years before the periods stop completely. The ovary doesn't produce any eggs, and this is doesn't produce any eggs, and therefore there is no hormonal cycling that's happening, and then the bleeding stops. So that doesn't produce cancer. But if you neglect it and you're having heavy bleeding, then this lining of the uterus sometimes can become cancerous. Or this is the cervix. Cervical cancer is a very common problem that we have in India. So one is you can give all your girls the cervical prevention for the cervical cancer vaccine. Do that. It's an investment that is worth its weight in gold, so that they will not get cancer. Like all the things, like you give smallpox vaccine, like you give measles vaccine, like you give all the other immunizations for the young child, the same way between 9 and 14 you will give the cervical cancer vaccine to the girl child, and she will not get cancer in the later years of her life. So it's an investment that you make for her health in the later years of life. So cancer is not something that is common, but you need to have a pap smear done once in 2 3 years, and you need to have an ultrasound done which shows the uterus is in good shape, there's nothing growing anywhere, and there's nothing to worry about. Post menopause, a lot of women have irregular bleeding, especially post intercourse. And that may be because there's cervical cancer that is brewing here. And when you have intercourse, that's the cancer there, then sheds cells and sheds blood. And that's why it's post postcoital bleeding, as it's called, is is a sign that you must go to your doctor immediately. हुआ था 6 महीने पहले हुआ था, and you are so busy that you don't have the time to go to the doctor. Don't do that. Your health is very important, and you need to take care and go to the doctor immediately, especially post-coital bleeding. All right.
Thank you so much. So, just summarizing, the vaccine is extremely important. It's an investment. People should go for it. If there's any heavy bleeding, they must immediately go to the doctor and take their opinion. Coming to the next question that was submitted by Irfana, she said that there is a belief that menopause is almost an end to a woman's active life, and also she's mentally not that healthy, mentally not and emotionally unstable. Is it so? And why menopause is still like a topic which is of shame and people want to hide when it should not be?
So I am 68 years old, and I've been menopausal for 18 years. It hasn't stopped me from being active. It hasn't stopped me from, running around and doing a hazard things other than my household. So you need to make up your mind and say that, yes, I am good. There is nothing wrong with me. And menopause doesn't in any way stop you from being active. So that's a myth. It's not there. The other problem with menopause is that you continue to eat what you used to eat when you were 18, 20 years. The activity has come down. And so if you're eating what you were eating at 18, 20 years, naturally you will put on weight. So you have to reduce the amount of eating that you are doing. You have to increase the exercise that you're doing. Because all of us tend to forget that exercise is a good part of our routine. What used to be normal 50 years ago, we used to be sitting on the ground, we used to be eating, sitting on the ground, we would be making masala, doing this, digging in the garden, we would be pulling water out of the well. All that exercise has now gone to seed. We now need to do the same exercise. Something as simple as, makhan nikalna. If we do this, then our arm exercise gets done without any problems. And because we now have mixies, we don't, dosa chahiye, but mixie mein banta hai, which means that you are not using your arms for anything. Otherwise, when I was 8-year-old, my mother taught me how to, grind the dosa ka aata, क्योंकि पत्थर में डालते थे और एक हाथ से इसको घुमाते थे और एक हाथ से we would push it inside. So if all of us do all the things that were done 50 years ago, where we sat on the ground, we did bending exercises, we did so many things that were part of our parcel. Now all of us have become couch potatoes. We are sitting on the chair, we are eating without bending, we are watching television. So all the regular exercise has gone in. So we have to put in exercise now. So 1, eat less, eat healthy, but eat less carbs really. And then what you need to do is to do more exercise. If you do both these things together and eat a calcium tablet, because as you grow older, the absorption of calcium reduces. So then your bones become weak because there's not enough food for the bones because calcium becomes deficient. So agar aap ye 3 cheez karoge, then you will find that you're fit as a fiddle and no question of having less activity. Jitna activity aap karoge, utna acha hai. So do that. Okay. So there's no menopause is not the end of your active life. And post menopause also you can have an active sexual life too. So there's no problem with that. Okay.
Thank you, doctor. So, because you were talking about exercise, and I see that in my generation, uh, working in a corporate, and especially in Mumbai, about 3 hours of travel and 9 hours of work. So people complain that they do not get the time. So, lifestyle has changed so much, and the work also demands that it has to be sitting all the time. Um, are there very simple exercises that you would suggest that people could integrate easily in their daily life?
First of all, don't use the lift to take you to the office. So that much of walking gets done
Mm.
because you are using the staircase at least 4 times a day. एक बार ऊपर, एक बार नीचे lunch के लिए, फिर ऊपर, फिर नीचे, and then walk as much as possible wherever you can. So that is what you need to do. 2, take an 8-inch plate. An 8-inch plate is adequate. Don't take a 10-inch or a 12-inch plate. Don't fill up the plate. You have to fill the hole in your stomach. You don't have to fill the stomach. The moment you eat so much that you can't take another morsel means that you have overeaten 50%. So at the end of a meal, there must be enough to eat another meal, enough space in your stomach. So try and make the meals more vegetables, less dense, this thing, more fruits, and then you will find that you are comfortable and you don't put on weight. Because once you put on weight in your 20s and 30s, you can lose it faster. But you put on weight in your 40s and then enter your 50s, you are overweight by 10 to 15 kgs, then it becomes a huge task to lose that weight. So therefore, you have to know what you're eating. So if you want to treat yourself once a week. Don't treat yourself 3 times a week, because when you treat yourself 3 times a week, that's when you'll find that your waistline, which was a beautiful 24, 26, is now reaching 30, and then it's going to be 36, and you're going to become like this. Don't do that. All right. So all people must be conscious that they mustn't allow their waistline to go up and the bottom line to go up.
Thank you. I think those are very simple exercise suggestions, as simple as just take the stairs. Uh, Dr. Nehal has a question. So, what can be done for cravings? Because even like my wife, she tells me every time that it's one thing to say that don't eat, but cravings are so natural. So, how do you kind of manage that?
Always look at what you are craving for. And my basic thing is, किसी ने आपको दूध पेड़ा दिया, पूरा दूध पेड़ा मत खाओ, आधा खाओ या क्वार्टर खाओ. If you then feel that you need to eat more, एक और क्वार्टर खाओ, तो totally you've only eaten half. अगर आप एक दूध पेड़ा लेके फिर the message hasn't reached the brain that the दूध पेड़ा has come to the stomach, then you pick up another दूध पेड़ा, 2 दूध पेड़ा हो जाता है. So always look at taking a small piece. Many small pieces will not be equivalent to one full piece. So that's the way you need to deal with craving. And you must start your meal with a fruit and salad. If you fill up your stomach with salad, then you will find that you will not crave for food again. And the other thing that you must do is to chew. If you chew properly and take some time and aram se khaoge, and don't look at the television and khana khao. So you're not you're so busy with the television that you don't know how much you're eating. You defeat the purpose, and then you are stuffed to the gills, and then next morning your weight is up by 500 grams. So don't do that to yourself. It's a disaster. So keep your weight whatever your height is, keep your weight between 55 and 60 kgs. Don't allow it to go to 65, 70 kgs. And then what will happen is that the extra weight that you have over your knees will give you knee problem, knee pain, and a whole lot of other problems that will come up because of excess weight. You don't want to become diabetic. You don't want to have osteoporosis. You don't want to, get the various uh, cholesterol problems. You don't want heart problems. All those things are avoided by keeping yourself slim and trim. So it's very important that when you are 20, you decide my ideal weight is so and so. Yes, when you get pregnant, your weight goes up. But remember, post delivery, 6 months post delivery, you must come back to between 60 and 63. Don't let it remain the 70 or 75, then you are in trouble. So, really, craving is input and output. इनपुट को कम करो तो आउटपुट को ज्यादा करने की जरूरत नहीं है, बट इनपुट को ज्यादा रख के आउटपुट को कम करना है. That means you have to do more exercise. So how do all our film stars remain slim? All of them have had babies. Deepika is having a baby again, but what she will do is do a severe regime post delivery. After she has fed her baby, given her milk, then she will be fine. Okay, so you need to do that, and we need to जरा मुंह बंद करना है, पैर को चलाना है और मुंह बंद करना है. Okay.
Thank you so much. I think there's a poetry in the solution that you just provided. Uh, since it's already 7:30 and we have to kind of cover a lot of other questions, so I'm going to start clubbing some of the questions as well, because there are a lot of overlaps in what we've received. The other one that we had received from Tanvi, and I think she is messaged here as well. So she's asking, when we speak about irregular bleeding during menopause, she wanted to check if it's still a monthly pattern or is it random. And she had posted another question that menopause causes random feelings of heat and suffocation.
So so menopause always results in hot flashes. Post the period stopping, you will start getting hot flashes. When you get hot flashes, the best thing is to go and have yourself a cold water bath, and make sure that you can take the calcium, and you can have cooling food stuffs that can help you to manage the hot flushes. It can't go away. It is part of it. So when we are young, we don't want our periods. When our periods stop, we say, "Arey baap re, kyun ruk gaya? I was so happy when I was having my periods. I was not having any hot flushes." So in any case, we are all wanting what we don't have, and all craving for things that are lost to us. So what is it that we need to do post post menopause, post stopping our periods? You need to make sure that you're taking enough calcium. You need to make sure that you're doing enough exercise, and that will keep you healthy. Okay. So irregular periods are when you don't get your periods. Periods don't come like BBC on the hour, every hour. Periods don't come for everybody. So people, especially if you put on weight, your periods will get delayed, and then you will have heavy bleeding. So if you want to remain slim, if you do remain slim, then you will be get more regular periods. All right, what's that question that has just come up?
So it says, this is a period related question. Women who have 3 or less days period consider it as a blessing. And I often advise them to visit a gynec. However, because they don't see it as a concern, they do not get it checked. Can it necessarily become a problem over the longer run?
So what is the problem with less periods? 3 days of periods is more than adequate. that means that there is enough lining of the uterus that is made and it comes out. So ideally, you shouldn't worry about less periods. Now, if you've had your 2 children, getting less periods is not a concern. It's only if you haven't had your babies, the 2 babies or the 3 babies that you want, then sometimes less periods means that the lining of the uterus is not thickening enough, and maybe you will have difficulty in getting pregnant. So don't at all worry about it. What we are worried about is excess bleeding and more than 5 days, more than 6 days. That is what we're worried about, because the hemoglobin level will come down and you will then find that you will become tired unnecessarily. Okay.
Thank you. The next one by Dr. Mehak. She says, "Why are women having perimenopausal symptoms so early in their lives these days?"
So it all depends upon, so we are born, when I was in my mother's womb and she was 5 months pregnant, all the eggs came into my ovary. And out of the 7 lakh eggs, there will be only 400 that ovulates. Now, if for some reason these eggs, vanish earlier, then it means that you will get your menopause earlier than 50, mid 40, 45, 46, 48. That's when you get your periods. So if your periods stop early, it means, and please don't have unnecessary hysterectomies, because when the uterus is being removed, along with that, the blood supply to the ovary goes away, and therefore the ovary sort of undergoes demise, dies, and then naturally, if no estrogen is being produced, then you have all the menopausal symptoms that come in. All right. So that's there. We all waited for our periods to go away so that we could be period free. Now what you have is this menstrual cup, which is available. You put it inside, it collects enough blood that is equivalent to 3 pads, and then you are completely period free. Happy periods you have. So no, most of us don't think that we can be happy during our periods. This is one new device that's available to all of us, which is called a menstrual cup, and you can use it. So if you want to know more about it, go to YouTube, look for Meenakshi Bharath, and you will get all the knowledge that you need about menstrual cups. Okay.
Thank you. Thank you so much. Just next questions, and this is something that you touched upon in the earlier questions as well. So, but it's slightly different. So, do all women experience severe symptoms like hot flashes and mood swings during menopause? And is weight gain during menopause unavoidable? So, do these symptoms happen to everyone, irrespective of?
Hot flashes tend to happen to everyone. It depends upon how you are psychologically placed. If you are of the happy attitude, and you do enough exercise, and you eat the right kind of food, then you don't have problems. But if you are the moaning, groaning kind, and you suffer from emptiness syndrome, where all your children have gone away and abhi aapko kuch kaam nahi hai, go and do some social service. Go and help out other women around your community, and you will find that that brings you lots of joy and takes your mind away from all the menopausal problems that otherwise become a huge burden for you. So basically, as you get to be menopausal, do more social service, and you will find that you won't have any of these problems that are eating you up normally post-menopause.
Thank you. That's a good suggestion. Dr. Mehak says that, and this is a lot of them that say that only natural or herbal remedies are always safer than medical treatments. If your mother had an easy menopause, you will too. So, is it true?
Your mother is your mother and you are you. So don't worry about your mother had an easy menopause and therefore you will also have an easy menopause is not a problem. It's not something, likha hua hai. So what you need to do is to take, so if I become diabetic, I need to take insulin. If I don't replace the insulin, then my diabetes will go out of control and I will land up ill. The same thing happens with thyroxine, the gland that is here, the thyroid gland. If for any reason it is not working, then I have to replace it by taking thyroxine tablets. The same way, menopause is a deficiency problem. The ovary doesn't produce estrogen anymore. And estrogen has kept us young, happy, healthy from the time we attain menarche to the time we attain menopause, which is a good 30 years. It has kept us healthy. It has given us good skin. It has given us good hair. It has given us good digestion. It has kept our bones good, healthy, strong. So when I attain menopause, my bones don't form as much as they were forming before. So there is a bone bank that is formed by the age of 20-25. If the bone bank, if the deposit in the bone bank is good, then osteoporosis will not happen till I actually, reach 70 or so. And then if I am doing regular exercise, weight bearing exercise, walking, all that, then my bones remain strong. When my bones remain strong, the chances of falling and having a fracture becomes less. So therefore, we have to do things to keep ourselves healthy and doing exercise, remaining slim, eating less sweets, all those go to giving us a healthy life in our postmenopausal years.
Exactly, and I think it actually drives down to the point that the lifestyle has changed a lot in the recent years, and that has been like the formula for a lot of problems and health problems and diseases, etc. But the point remains that good amount of exercise and regular exercise can help. We have another question from Amol, which and I you may please add to this, and it says how to deal with excessive back pain, low energy, and emotional distress during periods. So I think exercise is again the answer to that, and good food is the answer to that. But if anything to add, you may go ahead.
You make sure that you eat good food. And when I say good food, is not doodh peda, is not jalebi, right? You eat sabji and you eat ek roti. Do roti nahi, teen roti nahi. And that too, if you're a Gujarati, you make those thin rotis and it just goes. So make sure you don't do that. And that's it. Change the way you look at life. If you change the way you look at life, you will find that everything is comfortable and good.
Thank you. The other question is hormone therapy unsafe for all women?
I told you just now. If I am diabetic, I will take insulin. If I am hypothyroid, I will have to take thyroxine. So when I become menopausal, I'm one of those who's very pro hormonal therapy for menopausal problems. And when I become menopausal, I have taken hormonal therapy for the last 18 years. So I don't see anything wrong. You have to have a regular checkup. You can't say that मैंने शक्कर खा लिया, मैंने चीनी खा ली, मैंने sweet खा लिया, and I don't want to check my sugars. So the same way, once a year, a checkup on or in around the birthday day, have a checkup with your gynecologist. Make sure that your uterus is behaving itself, and you will be a champion.
I think personally, this is a great strategy, which is birthday doctor visit, because that will be a good reminder as well. Every time it's your birthday, you must go and visit the doctor, and this can clearly be like a proper campaign. which we will definitely kind of disseminate to more people. With that, we move on to the next
So the
question.
other question that
Yeah.
people don't want to go to the doctor, अरे हमको बुरी खबर दे देंगे. Why will if everything is fine by you, why will they give you buri khabar? You're good, your uterus is good, the cervix is good, there is no problem, your ovaries are fine. Then why will they give you bad news? They will only say, सब ठीक है, अगले साल वापस आइएगा. बस, that's all. So like I said, don't invest on clothes unnecessarily, invest on your health.
So I just want to like bring in sort of a different perspective on that. When we speak of medical situation in our country, and we see that a lot of the doctors want the patients to continuously come to them, of course, from a profit point of view. So that's one thing that people are slightly scared of. And just to add to that, when we look at how uterus removal process is being commonly promoted in places like Bid in Maharashtra, where there's again a profit angle. And including my mother, she had to get her uterus removed. My mother-in-law, she had to get it removed. A lot of the women I know, my friends' mothers, they had to get it removed. And that's something that a lot of women are scared of. And whether to trust the doctor or no. How do you kind of tackle this dilemma?
So trust is something that you have to instill in yourself, that the doctor is not going to do something that is unnecessary. And bead is a bad example. Bead is a bad example because the sugarcane people didn't want the women to have periods, so they got rid of their uteruses. We don't need it. That's why I said, if we will use the menstrual cup, you can keep your uterus, you can keep your health, you can keep your ability to carry the sugarcane, all that you can do just by changing from the disposable sanitary napkin and the kapda napkin to this. And this you can use from age 18 to age 50. और एक कप 10 साल आता है. So then you have to keep it carefully. You can't, when your period gets over, you can't just chuck it somewhere. And then you won't find it when your next period comes. So therefore, getting rid of the uterus, if the uterus is diseased, उसको निकालना पड़ता है. अगर आपका appendix खराब है and it is giving you infection, then you have to remove it. So उसी तरीके से यूट्रस जब हमारा 2 या 3 डिलीवरी हो जाते हैं, उसके बाद it is not necessary. But don't get your uterus removed when you are 30 or 35 or 40. Wait till you reach 45, 50, when the function of the ovary is more or less declining. And then if you remove the uterus, your menopausal symptoms won't come earlier. So don't be in a hurry to get rid of the uterus. But if the uterus is not doing well, निकालने में कोई हर्जा नहीं.
Correct. Correct. Uh, is it true that women cannot get pregnant once they start missing their periods?
See, pregnancy, as I told you, happens between 18 and 35, 40. 40 ke baad, the chance of getting pregnant reduces because the eggs are older. I told you, my eggs came into my ovary when I was 5 months in my mother's uterus. So my eggs are whatever my age is plus 5 months. Best eggs that will result in a pregnancy are between 20 and 35. Uske baad, it's only the older eggs that are not good and that are not capable of getting pregnant that are left behind. So therefore, the chances of getting pregnant as your periods become irregular or as you get closer to 40 years, yes, there is an occasional 45 who will get pregnant, but she has had 13 pregnancies. My grandmother had 13 pregnancies. Her eldest child and she was pregnant with her last baby at the same time. That means she was superb fertile. So there is no this thing saying that you can't get pregnant. But कितने दफा pregnant होते हो यार? 2 या 3, उसके बाद we can't afford it, isn't it?
With today's inflation, definitely not.
So don't delay your pregnancy. By 25, you have your babies. Between 25 and 35, you have your babies, and then you can aram se take care of everything else around you. Take a sabbatical, have your baby, and then pursue your career.
True. There is a menstrual cup question here from Tanvi, and she says, when you were saying that menstrual cup is much better, she says, isn't it a hassle, ma'am, cleaning the cup after urinating? So
After,
after urinating, isn't it? So I think there's a myth that you have to bust.
so there is a problem there. The menstrual cup is sitting in the vagina. The bladder is sitting in front, and you pass urine. You don't have to remove the cup when you are using when you're passing urine or stools. The cup, there are 3 passages for women. The cup is in the middle passage, the front passage is for the urine, and the back passage is for the stools. So ये cup बीच में बैठा रहता है, and you don't have to clean it, probably clean it 2 times or 3 times in a day. इसमें मैंने बताया ना, it holds the equivalent of 3 disposable sanitary napkins. That amount of blood it holds. So there is no problem there. So did I answer your question, or I got carried away?
No, I think you've answered that question. Tanvi, as she said, there are different openings, so this doesn't actually conflict with each other.
Correct.
So yes, please go ahead for menstrual cup, as we also promote sustainable menstruation through Maasika Mahotsav. Just one tip that I would want from you is that we've been thinking of talking to women, especially who are living on the streets, who do not have homes, and they do not have safe toilets as well. So would you advise menstrual cup to them as well? And if you would, what are the very minimum requirements that the menstruator must have, including a space to change? And many women, they find it difficult to remove it, and they try different positions of squatting, etc. But when women just do not have a bathroom at all, how do you kind of change it? Do you have any tips?
So basically, not having a bathroom is a condition which is difficult to understand. There is some bathroom somewhere. You are going and defecating first thing in the morning, you're going and passing urine through the day. How can there be no bathroom? And as far as the menstrual cup is concerned, when we have intercourse, we are not looking at hygiene. We don't clean our partners with hot water and soap. So why are we suddenly very worried about what the menstrual cup needs to do? The menstrual cup just needs to be washed with ordinary water that you will use to brush your teeth. So you brush your teeth, and there is no problem. You're not looking for sterile water. So here again, washing the cup, you don't need sterile water. Secondly, the vagina has lots of good bacteria that prevent any infection from going into the uterus. And this good bacteria doesn't make the cup infected. So don't worry about it. कभी सोचते हैं इंटरकोर्स करने वक्त इन्फेक्शन होगा या नहीं होगा?
I think that's a very important perspective, and we will try to include that in our sessions as well. Nobody goes and washes their partner's private parts, but yeah, that's an important perspective. We have another one from Radha here. It says it's very difficult to insert in vagina. It's painful for her. So
चप्पल, जब नया चप्पल खरीदते हो तो वो पिंच करता है तुम्हारे पैर को. थोड़े दिन इस्तेमाल करने के बाद द पिंच गोस अवे. इसको भी करेक्ट टेक्निक करना है. ऐसा बड़ा नहीं अंदर डालते हैं इसको. You reduce the diameter, so from a nimbu size it becomes an
Mirchi
a
size.
groundnut size.
Groundnut size.
And yeah, initially when you're first putting it in, it is uncomfortable, little difficult. उसके बाद ठीक हो जाता है. All of us women know that our first intercourse, सुहाग रात, is the worst disaster. उसके बाद आदत हो जाती है, and having intercourse is no problem. उसी तरीके से putting this menstrual cup inside is no problem, और निकालने में भी कोई तकलीफ नहीं. You call me for a menstrual cup
Session, yes.
session. Yes.
And generally, when people talk about that it's inserting is painful, are there any lubricants that you would suggest to them, or how do they
Coconut oil. And during your periods, your period blood itself acts as a lubricant. So you don't have to worry about it.
Correct. So it's important that you do not try it when you're not on period. So
You
might
don't
find-
try it when you're not having your periods.
Correct. And
Okay.
I think it's almost time's up, but I will take this last question here that we have. And you have, in a way, answered it, but it's slightly societal and psychological. It says in some communities, menopause is seen as a freedom from menstruation, while in others, it's loss of femininity. How do you interpret this duality?
I told you, no, loss of femininity is in your mind. If you think that you have allowed yourself to become a tub and put on weight, then that itself results in loss of femininity. You keep yourself slim, you keep yourself active, and you will not worry about loss of femininity post-menopausal. So do the things, do exercise, eat 50% of what you were eating when you're 20, and keep your mind busy, and keep yourself helping somebody else out. उसमें आपका जो imaginary दुख है ना, वो चले जाएगा.
Thank you so much for that. And with that, okay, let me just check if I have another question here. Sorry, but want to also point out that during intercourse, the penetration happens for a limited period of time. However, a menstrual cup remains inside the vagina for approx 5 to 6 hours straight before being emptied. Hence, this is just my opinion. Hygiene, access to clean water does play an important role while using a menstrual cup.
I told you the vagina has beautiful bacteria that keep away all the infection. Agar you're so upset about it, mat use karo yaar. You are losing the happiness of having periods by using the menstrual cup. उतना परेशान होने की जरूरत नहीं है. Okay.
Thank you so much. So just so that okay, there's one more question.
The pad that you wear is made of 90% plastic, and you're happy wearing that pad because you don't know that it is 90% plastic. So you're wearing plastic so close to your vagina, so close to the uterus. Nobody thought about it. For 60, 70 years, we have used these disposable sanitary napkins without worrying about what it is creating. It is part of the creation of cervical cancer. So you need to realign yourself and say, Abhi, not only are you using gas cylinders, not only are you using automatic cars, not only are you using mobile phones that are getting more and more complicated, all that you're using. So change to this so that you can have a fun-filled, happy period without worrying, अरे मेरा कपड़ा गंदा हो रहा है या मेरा कपड़ा stain हो रहा है. You can swim, you can do anything using the menstrual cup. Try it, and then call back and tell me your feedback.
Just one last one here. It says, what happens to the uterus in the body post-menopause? Does it have any function now that there are no eggs in the ovaries? If non-functional, can it harm the body?
No, it can harm the body if the uterus becomes larger in size and cancer starts growing in it. Otherwise, the uterus just becomes atrophic. मतलब कि अगर uterus का size इतना है in my 20s and 30s and 40s. By the time I get menopausal, ये आधा हो जाता है. And it just atrophies and becomes nothing. But you need to know that it has atrophied and become nothing. अगर कैंसर ग्रो होने शुरू हो जाता है, तो you need to catch it early. If you catch it late, then bye-bye.
All right, I think that's it. That's all questions. So I would just take a minute to remind everyone this was the third part of the menopause series that we are doing in Idea Exchange Forum of Maasika Mahotsav, which is the period festival. It happens from December 1st to 20th of May, when everybody, a lot of our partners in different geographies, celebrate periods, as Dr. Meenakshi has been saying, that you can have happy periods, and that's the ultimate thing that we also use as a premise to talk to people and normalize the conversation. And the next part, the fourth part of the series, will focus on how do we take the topic of menopause to the communities? What are the methods, ideas, etc.? And we will be joined by Dr. Anita from the Menopause Society of India. And the next session will not happen on a Sunday as we have been doing, but on Saturday at 7 p.m. We will be releasing the poster and all of the other details. Anybody who wants to get in touch with Dr. Meenakshi, we will share her email ID with all the groups that we've been circulating the session post, and they can get in touch with her. As she said, and we've been doing this also since 2017, do try menstrual cups. It's good for your health, for the environment as well.
Good
Any
for your
close,
purse.
and good for your purse. Yes,
So it's a no rash, no cash, no trash program.
absolutely. That's a great slogan, of course, coined by Green the Red and ma'am. Any closing remarks, and we are done for today. Thank you so much.
Yeah, so please send me this thing so that I can join you next month whenever you have the next session. I'd love to be a listener.
Great. We have it next weekend, which is 2nd of May. I will send the details across, and we would love to have you part of the Maasika Mahotsav community as well. You must also be in touch with Dr. Kala from Bangalore, and I met her, and she's also part of
Kala
Maasika.
Charlu.
Yes, and I think we look at all of you seniors for inspiration and the positivity that you bring in onto the table to talk about such an important topic, and we will carry on that legacy for sure. Thank you so much, ma'am, for your time. Thank you, everybody, for
Thank you.
joining us today.
Yep,
Thank you,
thank you.
everyone.